Good morning, everyone. This is our second session of day 4 of our biannual research colloquium here at Aspen University. It is a collaboration between Aspen University and United States University. Our faculty, our students, anybody in our academic community can attend or can present at the colloquium. This is our spring. We'll also have another in the fall. So for those of you who are watching and participating today, and we hope that you'll apply for our fall colloquium. Very busy room here today, Dr. Manning.
Well, thank you.
I'm getting inundated with all the admit, so this is good. Let me close that for a second because that is distracting me being able to see what's on my screen. But the continuation of our theme for today, which is retention in the nursing profession, and it is an important theme that impacts not only that profession but other professions. And tomorrow's theme will be retention in the teaching profession. So as you can see, helping folks choose our profession, get prepared to be one of our fellow professionals, and then staying in our profession for the long haul and not getting burnt out within the first couple of years and then leaving, and us continuously having to sort of replenish the folks who flush out from being burnt out, is an important topic for all disciplines. But today's focus will be nursing. So we have Dr. Manning, who will present her research that she conducted and the discoveries from that data. So Dr. Manning, I think I'll just turn it over to you and let you begin.
Awesome. Thank you so much, Dr. Trasher. Thank you for having me. Thank you for the committee to accept me into this presentation, this annual event. I am so excited and I'm so thankful for so many of my families and friends and social media followers to come on. You're going to be very busy trying to let them in. I saw my professor, Dr. Laurie on. Thank you so much for joining us. I know you guys live busy schedules and yet you still took the time to support me. I appreciate you guys. So let's begin. All right, so I first want to say good morning to some of you. And for some, it's good afternoon and even good evening because I have people international that's joining us today. It all depends on where you're from. Your time zone is different. So 38 years ago, I migrated to America. And on the screen, you will see my lovely immediate family. You will see my husband, Michael. We're married now, going on 7 years. And this is my eldest son, Ian. And my daughter just turned 18. She graduated from high school during the pandemic last year, and now in her first semester of college. I also have my youngest son, he's 16 this month, a matter of fact. So those are my heartbeat. My family, outside of them, my brothers and sisters, that population of members in my family, we have like about 12 nurses and other healthcare workers. You know, sometimes I joke about that we could open our own hospital, and I'm not kidding you. We have a whole lot of family members. So I usually joke about that. Becoming a nurse, though, by the way, was not my first passion. However, after my position at Motorola was outsourced years ago, I went into nursing. And it was a long ordeal getting into nursing, but I tell you something, it was the best thing I could have done. In 2009, I graduated with my associate degree. And you realize 2009 is only about, what, 11 years or so ago? I graduated with my associate degree, right, in nursing. And then I soon returned for my bachelor's in nursing. And while attending school for my bachelor's, I was offered positions at 2 different schools, but I felt incompetent. So I returned to Aspen University to complete my master's in nursing education. Soon after that, I went to Maryville University and get a postmaster certificate in adult gerontology, nurse practitioner, where I currently practice in my private practice called Legacy Advanced Health in Coral Springs, Florida, to see elderly patients. Now, I returned later to Aspen University, I graduated last year with my doctorate, and this research project that I'm presenting to you today was completed in my final semester during the pandemic. In 2018, after becoming certified as a nurse practitioner, I felt like there was more that I needed to do, which is why I opened the primary care practice in Coral Springs, Florida. I believe that I can do more, so I needed to get my doctorate so that I could also give back to the community. I could also mentor other nurse practitioners. One of my many gifts is to mentor nursing students. I currently mentor nursing students on an online platform that I've created called NCLEX Clinic. And you could access that through nclexclinic.com. Now, in this platform, what I do for these students is a lot of them finish nursing school and they're not able to pass their certification exams. Well, it's one of my gifts to help prep them for the state board. I've helped quite a few students during the pandemic. I believe because of the demand for those students to be able to go out and practice last year, between the month of August and September, I believe I helped probably about 50 students become certified to be able to practice. I've helped also nurses, women, I mean, not nurses, but other women who want to be business owners or leaders in the community, and maybe they're just scared to get started. Well, I have an online Facebook group called Sophisticated Women in Business, where I oversee and guide women and become entrepreneurs, because of course that's one of my many talents. I've owned a few businesses and I also believe in giving back, and part of giving back, I use that platform to reach those people. Now, doing so many things can become overwhelming and stressful for the ordinary person, which me being this way most of my life, I do different things to reduce stress in my life because it do come. So one of the things that I love to do is traveling. I travel to different areas in America. My goal is to get to every state in America, and I believe I'm up to about 26 or 28 of those states. I love to travel. That's how I reduce my stress in my life. I love to go to the mountains and to the ocean. Now, this research consists of extensive interrogation of literatures and data collected last year, and it was of the nurses working in Florida. Now, right now, on your screen, there's a link. I would like some participation if possible. I would like for you to just open up another browser and type this link into your browser and just complete this questionnaire. It's only 10 questions and it's gonna tell you immediately your stress level. Now, keep in mind, this is over the last 30 days. So when you're answering the questions, just focus on what happened in the last 30 days, okay? While you're doing this, I'm just gonna tell you a little bit about this tool. Who's the person that developed this tool that you're about to take the questionnaire, okay? So, and by the way, just take about 2 minutes because it's only 10 questions, so it should not take that long. So I'm just gonna read, tell you a little bit about this, the developer of this tool, okay? So Dr. Sheldon Cohen created this widely used scientific tool to detect a person's level of stress within the last 30 days. Dr. Cohen work focuses on the role of stress and social support system in health and well-being. During the last 30 years, he has been studying the effect of stress effects and social support on immunity and susceptibility to infectious disease. His classic work on the role of psychosocial factors in susceptibility to the common cold has been published in the New England Journal of Medicine and the Journal of American Medical Association. The perceived stress scale is what is called, and it's abbreviated PSS, is the most widely used psychological instrument for measuring the perception of stress. It is a measure of the degree to which situations in one's life are appraised as stressful. Items were designed to tap out unpredictable, uncontrollable, and overloaded respondents find their lives evidenced by validity. So the higher your PSS score were associated to, some of these things that this tool have used was the failure to quit smoking, failure among diabetics to control their blood sugar levels, greater vulnerability to stressful life events, and illicit depressive symptoms. So by now, some of you should finish. When you complete it, just comment in the chat box and just say done. Great, I'm seeing comments coming, but still we have a lot of people. Let's see how many of you finish. I don't want to leave you guys behind. Great, we're up to 11. There's 21 of you. I know some people may not complete the quiz, but let's just give you a few more seconds before we move on. All right, so you could continue to take the quiz as I move forward. So today's objective, this session today will determine what is known about burnout. It will also educate and provide interventions to reduce the incidence of burnout. But overall, I will be sharing the result of the study of the nurses' work in Florida last year during the pandemic over a 30-day period. So what exactly is burnout? Burnout is defined as having chronic emotional overload, feeling of emotional exhaustion, having a lack of interest for the job or patient care while demonstrating avoidance behavior. Now, my question to you guys, and you could comment in the chat, I know as show of hand, since I'm not chatting, you could see it over here. How many of you guys have encountered episodes of burnout or feeling so stressed out that you feel like you couldn't cope? Just comment in the box if you have, because this is something that so many people are going through, and sometimes you don't even see it as a problem. Ask yourself this question. Can you relate to it, or do you know someone or a co-worker? And believe me, you do not need to be a healthcare worker to be going through burnout or feeling overworked or stressed out. So if you know someone other than yourself that have been struggling with this, just comment in the box, okay? Let's make this an interactive session so we don't fall asleep on me, okay? All right, so why did I select burnout? As a new nurse, I was burnt out. When mentoring nurses, I heard the term all the time, and I know you guys can relate to this because I'm hearing it from time to time right now. I've heard the term used so loosely as if it's nothing, like it's a part of your life. But when doing the research on burnout, the studies were coming back really bad. You know, it was showing that 50% of the nurse calling out of work was due to burnout. Prolonged stress, such as working in the ER, oncology, or many other environments have led to chronic medical issues. These are like diabetes, heart disease, right? Stroke. There's a lot of chronic issues out there that is a issue because of burnout. Now, 87% of nurses in one of the study listed burnout as the cause of inadequate patient care. 87 is pretty high. Now, burnout is a huge thing. For those of you who work in healthcare, you are familiar with the Joint Commission. And for those of you who don't, the Joint Commission is people who go around and survey organizations like hospitals to make sure that they're following certain guidelines. And burnout now is such a big deal that they also classify it as one of the top safety issues. While companies such as organizations such as the World Health Organization now allows people like myself, practitioners, to get reimbursed for a billable code, which is Z73, when you're charting, when you're requesting for reimbursement, we can get reimbursed for this. Now, they did not list it as a medical diagnosis, but it is a billable code now, okay? It's like a phenomenon. So it's a collective of things that's happened, because you know burnout could be stemmed from different things. So now we could actually get paid for it. 50% of the nurses believe their employment is the reason for being sick. 50% believe it's their employment that causing them to be sick. The studies looked at show between 35 to 70% of the nurses report feeling burnout in one study. One of the study said high intensity departments such as long-term care, guys, believe it or not, is listed as a high intensity. Usually you'll hear acute care like hospitals being listed as such, but long-term care is also a problem for nurses in relation to becoming burnout. Mental health facilities showed 98% of the nurses suffering from burnout. 98, that means only 2% is functioning as full capacity. Wow. Not only in America, I'm not talking just America, I'm talking in other countries. There was many countries involved in this research. In fact, China reported, there's a study in China that reported that 41% of the nurses were feeling burnout. And place like Gaza, the Palestinian nurses said, research said 70% of them were feeling burnout. When a nurse is burnout, certain things occur. You can find that they have more medical errors. You know, medical errors is killing a lot of patients. Higher infection rates. And a lot of people are dying because nurses are burnout, or not just nurses, but healthcare workers like physicians. It's worse for physicians, but these studies were on nurses. So you'll hear me say nurses a lot, but the study is not just on nurses, even teachers also have it. And if I have to go with the military, it's even worse when it comes to military. But listen, that's not the only issue. With the baby boomers retiring, I know some of you are aware that the baby boomers, a lot of them should have already retired, but they stick back to help because there's a large shortage of nurses in the healthcare. So a lot of them fail to retire. There's a greater demand because these baby boomers are getting ready to retire, and studies show that baby boomers have 3 or more chronic medical issues. 3 or more medical issues. But the bad thing is, when you do a survey of nurses currently working, 68% of them are baby boomers. So now you're going to have a large population of nurses retiring with 3 or more medical issues, needing care from nurses, but we have a large amount of shortage going on right now globally for nurses. So one of the study revealed that suicide also is a serious issue with the nursing population and also physician. In fact, 400 nurses were listed as committed suicide due to burnout annually. And by the way, this study was not on all 50 states. It was only, I think, about 12 states included. So imagine what would happen if the entire country got surveyed to see how many people died, especially now during the pandemic. So considering the continuous shortage of nurses and the impending crisis of retiring baby boomers, there's a demand to preserve our nurses. Caring for patient requires the characteristics of caregiver to be mentally, physically, and emotionally sound, which requires a nurse to recharge. The demand has intensified because despite the many nurses entering the workforce as registered nurse, there is still a shortage of nurses to provide medical care. The demand for nurses has increased, however, affected by burnout and compassion fatigue. Compassion fatigue, by the way, is when you have people feeling numb. Things that would normally bother them don't bother them anymore. They get numb to it. I like to give this example for myself. When I was going into nursing, I was kind of scared to get involved because I was scared of seeing dead people. I was so nervous, right? People always say blood, but for me, it was that. And my last day of nursing school back in 2009, my patient died. And I was so distraught. I was like, I called my school. I said, I'm done. I can't do this. This was the last day of school. And I was ready to give up, because that was so overwhelming for me. Well, fast forward, after working in the hospital and seeing so many people dying, it did not mean anything to me anymore. Well, if you are in prolonged situation, prolonged stress environment, eventually you don't even realize that this is affecting you. So the purpose of this study was to screen nurses for burnout, assess and educate them about the consequences of burnout. However, the actual goal of completing the project was to bring awareness about burnout and provide interventions that's proven to reduce burnout. And during the study, you have to come up with a clinical PICO question. And the question was, does watching a 4-minute interventional video help to identify and reduce burnout in nurses working in Florida over 30 days? It was many articles, literatures reviewed. In fact, I looked at over 26,000 was pulled, and it was compiled with different themes. Some of the themes were burnout and turnover rate, burnout as it relates to patient care, burnout as it relates to chronic medical issues, and the interventions to reduce burnout. And after doing all the looking through the articles, 54 of them was selected for the study. The instrument used, you just experienced the perceived stress scale for those of you who took the quiz, the survey. That's exactly the same instrument by Sheldon Cohen, but there was another survey tool used. It was 11 questions, and this tool was asking questions as it relates to burnout and the population of nurse to see their knowledge base, and the result will be presented in a few more slides. These are the questions that was you just took on the screen. for those of you who did not get to participate in the survey just now, here are the 10 questions. Next on the screen, you will be able to listen to the actual video. This video is going to teach you about, it's going to provide awareness, and it's also going to give you a quick intervention that you can do while working. Not, I mean, you know, during work, sometimes you wish you could listen to music, you wish you could have a massage, but it's not practical, right? So this tool will now give you things that you can do to relieve stress while working.
Hi, my name is Pamela Manning, and I am a board-certified nurse practitioner. And I am currently completing my doctorate degree in nursing. But today I would like to bring awareness about an issue that we have all encountered while working in acute care. The issue is known as burnout. Burnout is defined as a chronic emotional overload leading to emotional exhaustion, lack of interest for the job or patient care, while demonstrating avoidance behavior. Did you know that over 50% of the nurse calling out of work is due to burnout? Well, it's such a big thing that the Joint Commission listed burnout as one of the leading safety issues affecting patients. Last year, a survey was done with 18 different states combined, and it was concluded that burnout have led to at least 400 nurses and physicians committing suicide annually. If you are a nurse working in high intensity department, such as the emergency room, ICU, oncology department, med surg, OBGYN, mental health department, and even some in home health care, you are at increased risk for developing burnout. Burnout can lead to inadequate patient care, medication error, substance abuse, high turnover rates, and nurse shortage, especially PTSD and other mental health conditions. To reduce burnout, you may practice these research interventions. There are music therapy, yoga, guided imageries, massages, mindfulness-based stress reduction, meditation, and more. A few years ago, I was burnout. I was caring for these kids at home, going through a broken marriage, and one day I just had one of those days at work that the call light kept going off. Everything just seems to be going wrong. That day, I actually hung the wrong IV fluids on the patient. I was so distraught that I tried to kill myself. And if it wasn't for this one intervention, I would not be sitting here today. So I would like for you to share it with you. All you have to do, it could happen while standing, sitting, any location. All I request is that you just block out any negativity. Think positive. I would like for you to close your eyes. Remove all negative thoughts out your mind. Inhale slowly. Exhale slowly. And think of positive imageries. Think of the ocean. Think of the mountain. Just think peaceful. Also, just picture seeing someone you have not seen in a long time, someone you're really fond of, and just embrace that person with your eyes closed. Wrap your hands around them and just take a deep breath. Now rest your head into that person's chest. Smell the fragrance. And as you just watch it and inhale it, just release your hands. Then open your eyes and open your mouth widely as if to say, yes! Thank you.
Awesome. Well, guys, that is what we call guided imageries. And as nurses, one of the first things they presented to us back in 2009 that we could help our patient by teaching them this. But as nurses, we all fail to take care of ourselves. Well, I don't know any nurse that actually, when things are going wrong, they put themselves first. It's usually we focus on others. For myself, I utilize, like, for instance, when I have to go to grocery shopping, I will go to like these BJ's and Sam's and get bulk orders. And I get 2 shopping carts filled with groceries. And when I get home, I packed out everything. And the next day I may wake up and there's nothing in the house for me to eat, because I always focusing on my kids or my spouse, but I keep myself for last. So the last, say, 7 years, I've been focusing on self-care. And I would like for you guys to also do the same thing. I do for myself. Now, you don't have to do the same things. I love mountains, I love oceans, so I'm going to utilize things that I know will give me peace. So for you, think of things that bring you joy and just picture these things and what you're breathing and see that your stress level will reduce. So the sample and the setting for this research, just so you know, it was a quantitative study using a quasi-experimental design, and it includes those 2 tools that I just presented to you. And we did a pre and post survey. So we did before and after survey, and you could see the population that was studied, the age of 18 to 70. And there was most female than male. And